Hi, everyone. Good afternoon and welcome to the 16th Annual Student Conference on Global Challenges, Life in the City. This is the Public Health and Medical Innovations panel. Our panel will run until 3 p.m. We have several students who are looking forward to presenting their work. The way that things will progress is that each student will share their screen and provide us with information with their presentation. And then at the end, after everyone has presented, we will open up the floor for questions, and we'll get to those logistics as we progress. But we'll go ahead and get started so that we stay on time. I would like to first introduce our first presenter, Bella Ryan from the College of Arts and Sciences. Title of her presentation is Applying Public Health Efforts of Harm Reduction in Copenhagen to the Drug Overdose Epidemic in Philadelphia. Bella is a senior psychology major and neuroscience minor here at Drexel. She's also been working as an EMT in Kensington for the past several years. She has been serving as the Neuroscience Society's president and became interested in the cognitive basis of addiction and wanted to learn more about public health efforts to address this in community health. She studied abroad in Copenhagen to focus on addiction and criminal justice, and that led her to become passionate about harm reduction and public health efforts regarding opioid use in urban settings. She's looking forward to graduating from Drexel this June and continue her research in a Master's of Public Health program that will focus on community health. So I will turn the floor over to Bella to share her screen and share her presentation with us.
Thank you so much, Allison. I'm a bit of a boomer with tech, so I'm going to share my screen. I'm also going to shut my camera off and then I'll get started. You guys able to see this?
Yes.
All right. So hi, everyone. Nice to meet you all. Like Allison said, my name is Bella Ryan. I'm a senior studying psychology and neuroscience. Be out of here in a few weeks. And I've been working as an EMT out of Kensington for the last 2 years. I'm literally right off KNA. So as many of you may be familiar with, Kensington has been especially hard stricken by drug use and overdose. So through treating many people in this community, I've become really passionate about public health efforts to address their circumstances. I'm from New York City. I grew up there and then I came to Philly for undergrad. So I'm a city girl by nature. I love this urban setting. And like many of you, I'm sure, I have personal experience with loved ones and community members from back home who have struggled with addiction. So I wanted to learn more about what can be done to improve how we approach drug use in the city. So I became passionate about public health as I was working in my undergrad. And because of COVID hitting when I was a freshman, this came a little bit later. So I didn't get exposed to many public health outlets or public health classes until later on now as I near graduation. So a great opportunity I was happy to jump on was studying abroad in Copenhagen, Denmark, which many people consider to be the happiest city in the world. So happiest city in the world, what are they doing to address drug use and what does it look like there? Does it even exist? So obviously it does exist. It's a global crisis. And I learned a lot about what they do to address it and how they work to improve community settings regarding drug use. And I'm excited to share that with you guys. So start over here. I like to Allison's idea of arrows. So be coming over here, talk about some harm reduction. Harm reduction was the biggest takeaway that I learned from Copenhagen, and especially from their community of or their culture of community and design. Harm reduction played a big part in how they approach drug use. So just like the term implies, harm reduction is all about reducing the associated risks of any behavior. For example, we wear seatbelts when we drive. That's a harm reduction behavior. And like using an opioid, it's instead of encouraging an abstinence-only method to avoid negative outcomes when using a drug, because the reality of it is everyone will use a drug at some point in their lives. I know many of us can't go a day without coffee. So fundamentally, we should recognize that a person using serious drugs like heroin, but that deserves treatment and support as we all do, and also deserves the assuredness of reducing the risk of death and other possible dangerous outcomes just because they're using a drug. So this leads us into the health belief model, which is a tool of social science, it's a big public health tool I'm a fan of, to look at health behaviors on an interpersonal level and encourage both positive actions towards promoting health, as well as avoiding negative outcomes that could be potentially harmful. I really like the health belief model because in the US, we have an especially Puritan capitalist culture that is heavily individualistic, and it creates a really negative stigma around drug use. So when we look at the health belief model and its dynamics, we are cued to action. And then when we incorporate that into drug use, it reminds us that there are many different aspects that goes into how someone could come to use a drug, how they can come to misuse a drug, and the consequences and results that come after that. So I like the health belief model. It looks at the whole picture. And harm reduction is the perfect example of cueing us all to look at drug use and people who use drugs through a multidimensional perspective that often requires thinking outside of the box to do what's best. So when we look at the numbers to back up this claim, Philly is especially struggling with drug overdose, with over 1,200 unintentional overdose deaths in 2017 alone, 77% of those including fentanyl. I think it's important to note that these overdose deaths are unintentional and are heavily involved with fentanyl, which, if you guys are unfamiliar with, is a pretty serious opioid, synthetic opioid. So, however, in the following year, in 2018, Denmark as an entire country saw just 138 overdose deaths, with the most reported in their biggest city capital of Copenhagen. So Copenhagen is a really awesome urban setting. The population of Copenhagen and Philadelphia are similar, about 1.4 to 1.5 million people living in each, especially at the time of 2018, that time. So what are they doing to reduce so much overdose deaths? And how do we bring that to Philadelphia? So here I lead into my favorite part, some policy campaigns. This is been a topic of discourse over the years in this realm, so I'm excited to talk more about it. So for starters, Denmark has opened 13 drug consumption rooms nationwide, with 2 in Copenhagen. Drug consumption rooms are basically harm reduction centers that are often tied to housing units that individuals can freely and anonymously visit to get clean supplies and safely consume drugs in the presence of medical interventionists when needed. So drugs can be checked for impurity. I know in Philadelphia, we have some good resources to get fentanyl test strips. Drugs can also, at these drug consumption rooms, be taken safely. And overdoses can be reversed quickly by professionals in the event of that occurring. So Menengeshem, I am so Americanized, I hope I'm doing that justice. I've actually visited, so do my best. Menengeshem is the world's largest drug consumption room. It was previously, or in Danish, it's known as the men's home. And from the early 1900s, it was a men's shelter that has now become the world's largest drug consumption room, also known as fixed room, or as Philadelphia puts it, overdose prevention sites. And basically it's a big housing unit that a lot of people who are unhoused due to the circumstances of using a drug in urban settings can go. And if they don't live there, they can just use the drug freely. There's smoking rooms, there's injection sites, they have a bunch of resources, and they have a lot of community resources too. There's like a little cafe stand, cafeteria. So yeah, those are drug consumption rooms. Safe House, if some of you may heard of, is something similar, more aligned with an overdose prevention site that Philadelphia has been blocked up in legislation from opening for the past few years now. When I presented my poster here, like my research from Copenhagen, we actually presented it to one of the heads of Safe House. It was really interesting. It was really awesome discussion. And hopefully in the future, Safe House does come to fruition. They attempted to open it in South Philly, but the need is obviously much more localized to Kensington and the North Philly area. So more campaigns and more legislation is being worked on to advance that goal and hopefully have something open soon. I think there's one in Rhode Island and there's a few in New York. So the US is seeing some of this happen, which is really awesome. And we do have Prevention Point Philadelphia, which we were talking a bit about earlier. It's an awesome harm reduction center in Kensington that provides many of the free and accessible services that drug users so often need. Some of those including social outreach, like access to employment and housing. Similar to Danish programs, they offer similar outreach, syringe services. So there's a syringe exchange, resource services like Women's Nights, a weekly drop-in where people who, anyone who identifies as woman can come in and get a shower, get testing services and other services that Prevention Point offers. They do a lot of good service stuff, so be prepared for me to say the word service a lot more. So there's more testing and wound care services, community enrichment, etc. And finally, something that we can all be proactive about is Pennsylvania's standing order to receive and administer naloxone, also known as Narcan, under Good Samaritan laws. So there's programs such as Next Distro, where you can order Narcan to your home anonymously and freely, and you can learn how to use Narcan from the Philadelphia Department of Public Health. They do, I think, weekly or like semi often, at least monthly, virtual like training services online where they show you how to use Narcan, show you how to spot an overdose. Anyone can get it. I think you can get up to 4 or 5 a year, or in I think like a fiscal quarter or something. But yeah, you can get naloxone and you can administer it in Philadelphia. Obviously, in Copenhagen, they have a lot more systematic institutions for this to happen, and for inevitably for like this whole drug use environment to come to a more, I don't want to say controlled, but I guess like a more community setting, such as the drug consumption rooms, where professionals and medical interventionists can attend to drug overdoses if needed. But in Philadelphia, we don't have that. So it's good to know that we can just get a Narcan and really easily learn how to use it and administer it. And Drexel, such as students of sensible drug policy, Drexel has some great undergraduate organizations that hand out and train students how to use Narcan. They hand out some fentanyl test strips, some awesome resources right here on campus. And then finally, the Philadelphia Resilience Project, also known as Sparrow, the Penn Injury Center, has been studying the Philadelphia Resilience Project, which is a coalition to analyze how drug overdose is trending in Philadelphia and what interventions and campaigns can be used to, or can be promoted and established to intervene with the numbers of unintentional drug overdose in Philadelphia. So much work is still needed to be done. Safe House is still heavily being worked on, and I believe that that would be a great introduction to Philadelphia, especially in the Kensington area, for both locals and for people in the area who are using drugs. But I'm confident that Philadelphians care for their neighbors deeply and will continue to work to support the drug use and overdose epidemic in Philly. Yeah, thank you guys for your time.
Excellent. Thank you so much, Bella. That was great. We are going to keep on time and move right on to our next presenter. And then, like I said, we will do questions at the end. Our next presenter, let me just go down. So Hebah Elhak first started her public health journey as a licensed practical nurse in 2014. She later transitioned to earn a BS in community health from George Mason University, and she's completing her last term at Drexel University, where she's focusing on getting her MPH in global health. And the title of her presentation is A City on an Island, Malabo in Equatorial Guinea. I will let Hebah share her screen as well, and then be able to share with us.
Hi, everyone. Thank you, Allison, for the introduction. So I'm going to go ahead and share my screen, and I will turn my camera off. All right. Can you all see it?
Yes, it's in sort of that slide.
Okay.
View.
Okay. All right. So this past March, I was hosted by the Bioko Island Malaria Elimination Project for a study abroad opportunity. And this project is a development of, it's a development of the medical care development organization. So I will discuss malaria control efforts made by this project while also addressing the challenges and ways to move forward. So here you can see Bioko Island right here. And here is Equatorial Guinea, which is on the continent of Africa, on the mainland. And what makes this sorry, I'm not sure why it's doing that. What makes this country unique is that the capital is actually located on the island. Sorry, let me see if I can figure out how to take this off. Okay. Sure, it's doing that. Okay, yeah, so what makes it unique is that the capital is located on Bioko Island, and Equatorial Guinea has a population of about 1.2 million. And malaria transmission is hyper endemic there, which means transmission is year round. And the most common parasite found there is P. falciparum, which is the most severe parasite, and it requires 24-hour treatment. It requires treatment within 24 hours to avoid serious illness. So the Bioko Island Malaria Elimination Project was established in 2004, and its aims are to improve the burden of malaria on Bioko Island specifically, so not on the mainland, just Bioko. And the prevalence in children ages 2 to 14 has decreased by 63% as of 2019. And the island has had an overall 55% reduction of malaria. The project has also eliminated 2 Anopheles vectors. And these successes have been due to indoor residual spraying, which you can see in the top left photo. And this is where they spray the homes with insecticide. And they've also distributed insecticide-treated bed nets. They diagnose and treat malaria, and they monitor and evaluate systems to best find, case management of malaria. So some of the challenges, although they've had successes, there have been pockets of high transmission intensity, and these are due to cultural beliefs and practices. So this means the community is not perceiving malaria as a significant health threat. There's also distrust in the interventions through efficacy and safety. Also, practices like collection of water in open containers, also inadequate infrastructure. So a limited access to healthcare services and limitation of resources. And especially because it's on an island, they have difficulty with importation of materials and supplies. So that means those like working in the labs, they have to find ways to extend the use of their supplies. And also they have insufficient drainage systems. And these are both in communities and neighborhoods, and also during construction projects. And another challenge is the mainland, which is also called Rio Money. So there's a high rate of transmission on the mainland itself, because the efforts of this project only focus on the island. But there continues to be travel between the mainland and the island. And this travel is due to the more active economy on the island. And also there's a high military presence on the island. So there's constant back and forth with military from the mainland. And the prevalence of malaria in children ages 2 to 15 years old is at 17.4% for Bioko and 43.8% on the mainland. So you can see there's quite a difference there. So in the first photo, you can see that this was a bucket that was left outside someone's home. And this is critical because having sources of open containers like that is a breeding site for mosquitoes. Sorry. And in the second photo, you can see one of the project workers. He's throwing BTI, which is a larva insecticide, in a collection of water. So areas like that are large breeding sites for mosquitoes, and the insecticide kills the larvae by them feeding on it and then dying. And the third photo is just more water collection due to construction sites and improper drainage systems. So this figure shows travel in between the 4 districts that are located on the island. So Malabo is right here, the top red portion, and A shows the actual size, and B shows those who travel from Malabo to other districts, and C shows those who live outside of Malabo and travel to Malabo. So because Malabo is the capital city, there's a lot of travel happening there. And in this specific case study, 89.8% of people who inhabited the island traveled to Malabo, and also 84.3% of off-island travelers are bound to the mainland. And that's critical because, as I said before, the mainland has a higher prevalence of malaria. So those leaving the island and going to the mainland, a lot of them come back and transmit it to the island. And a majority of the people on the island are always in the area of Malabo. So strategies to move forward. It's important that we engage with the community and develop trust, and really have them understand our findings, and that way, you know, while I was there, I got things said to me like, well, they sprayed my house last year, but I still got malaria, or I'm still getting mosquitoes in my house, even though they sprayed my house. So just trying to educate them and having them understand really what the intent is. I think that will definitely help them understand why it's important to spray their home, that it's not necessarily you know, going to stop mosquitoes from coming in, but it will definitely decrease their chances of contracting malaria. And also investment in healthcare systems. So that will help with improving case management and implementing proper drainage systems, both in neighborhoods and on construction sites. And another critical recommendation is to coordinate with the mainland. So when I was there, it was kind of felt like a sense of disconnect between the mainland and the capital. So they definitely need to coordinate together, and especially because of the high rate of travel, because, you know, the rates on the mainland are higher, and whatever control efforts are going on the island, those coming from the mainland will eventually, you know, increase the prevalence on the island. So, and that is all. Thank you very much.
Excellent. Thank you so much, Hebah. We are going to continue with our next presenters. So I know they're going to share their screen and I can introduce them both. So Meghan Gupta is a dual degree BS and PH student in the Department of Community Health and Prevention at the Dornsife School of Public Health. Her research interests include food insecurity, effects of vaping and smoking, community engagement, and social determinants of health. She recently completed some global health research to understand policies directed at violence against children in the Middle East and North Africa. And Alexa Primavera is a Drexel University College of Medicine recent graduate, pursuing her dual degree MD and PH with the concentration of community health and prevention as well. She's passionate about women's health, reproductive rights, and serving marginalized populations. She currently works for the Philadelphia Department of Public Health in the HIV program, serving women who are living with HIV. Alexa will soon be starting her residency in OBGYN in July at the University of Pittsburgh. So I will let Meghan and Alexa, I think Meghan's going to share her screen and then we will jump right in.
Thanks so much, Allison, for the introduction. Meghan is sharing her screen. I can see it, Meghan. It looks good. And I'm gonna also turn off my video. All right, so good afternoon, everyone. Meghan and I will be presenting a program evaluation proposal in collaboration with Esperanza Health Center. And this project was really born out of actually a class project we did for CHIP 501 called Community Engagement in Public Health Practice and Research, which Allison was the TA for. So Allison is very familiar to you. So the whole point of the project was to partner with community-based organizations in Philadelphia and engage with them in what they needed out of us with, the resources that we have as Drexel students. And Esperanza came to us with an idea for an evaluation. Next slide, Meghan. So Esperanza Health Center is has 3 sites throughout Northern Philadelphia. They're a Latinx-based faith organization with a commitment to providing affordable and bilingual healthcare and wellness services to the largest Hispanic community in Philadelphia. The focus of this project will be in the Kensington location that we marked on the map with a star. Next slide, Meghan. So the program of focus for this project is called Parent Circle. It's a weekly bilingual workshop for parents and caregivers over a period of 6 to 8 weeks. So facilitators lead lessons followed by group activities and homework for the parents engaged in the Parent Circle. And you can see some of the topics in the curriculum here on the slide. Esperanza has identified a need for recommendations specifically for this particular program's evaluation. Some identified challenges are their open cohort model, a need for a longer term evaluation, and a mismatch between survey evaluation questions and program goals. Next slide. So this slide shows the relevant demographic characteristics of Esperanza's community. There is an overall poverty rate of about 44%, with 60% of children living in poverty. The average income is about $12,000 per year, as shown on the map. And this high poverty indicators are correlated with high food insecurity as well. Another relevant statistic is that single parent households are more common in this area with a rate of about 34% compared to the city of Philadelphia average of 15%. And notably, about 51% of individuals in the 19134 zip code are Hispanic, which is the Kensington zip code. This next slide is the purpose of the project. So to guide the proposed project's development, the principles that we used were from 2 concepts to determine best practices to showcase to Esperanza. One is the community-based participatory research, or CBPR, and the second is empowerment evaluation. CBPR is an collaborative approach to conducting research where community members are involved in every step of the process, while the empowerment evaluation concepts are relevant as this project is centered around evaluating an existing program. And this approach aims to provide this community organization with the tools to evaluate their own program internally rather than relying on outside stakeholders.
So based on what Alexa described for the 2 models that we used, that's how we created our project proposal. And the top 3 project ideas that we came up with were monitoring program attendance, social inclusivity, and an evaluation workshop, all of which Esperanza representatives asked us to look into. And we did this through a literature review. So we submitted about 8 to 10 page lit review describing various articles and sources from various parts of the country to help us come up with this project. So for the first aspect of this project, where we want to monitor program attendance, we focused on creating a parent circle app, which can be used for phone-friendly individuals. And this app would be used to track attendance because that was one of the issues that Esperanza was facing in their circles. And since they do have an open cohort model, we would recommend for them to go through a quick survey where they're deciding if they want to continue with the program. And if they don't, they will be taken to a feedback survey, which can be utilized to better the program. Some strengths for that is that it's easier to track that in an open cohort model. They can track who is attending and how many sessions there are, and it's very easy to gain feedback. However, some of the weaknesses include the money is a huge aspect, which will be used to create the app and all the technical services required for that, and also people who would need to be hired in order to maintain the longevity of the app, technical difficulties, and then a digital divide with some people may know how to use phones, others still struggle. So that would be another issue. For a second component of the project, we focused on social inclusivity. So that targets on social determinants of health, which include transportation, as well as cultural competency, which will focus on highlighting like cultural beliefs, as well as schedules and commitment and date sessions, which was another issue that Esperanza had brought up. So some of the strengths for that would be if community members were involved in this, in the parent circle process as facilitators, this could increase attendance because there's more trust within the community. There will be limited issues with cultural beliefs because the community members are immersed in the culture, and it also eliminates stereotypes and assumptions, which is very important when we're trying to implement a program like this. However, one of the weaknesses is that there will be training that will be necessary. And again, there's money that would need to go towards that. And in a hierarchy between where the money, how the money comes into community-based organizations is very limited, unfortunately. For the third aspect, we want to focus our project on an evaluation workshop, which highlights conducting pre and post-test surveys for the community members who are part of the circle, but also for the facilitators. This again will assess effectiveness to see what can be better, what can be done better, and what is already working. So we actually found an open door tutorial, which is a guiding framework that can be used for these pre and post surveys to be given, as well as focus group handouts that have lists of guided questions that we provided to them. And again, some strengths of that are that there is knowledge for future changes to the program, strengths and weaknesses of the lessons, and they can tailor it to how they want to target their specific audience. And then community voices are being heard. However, some of the weaknesses include that this may not be able to happen every 6 months because of resources, because CBO's bandwidth is also very limited, which can push this off to the side or not get done at all. And an open cohort model means that it could affect how many people do a pre or post test, because an open cohort model allows people to join anytime in the span of the program and leave anytime in the span of the program. And in terms of sustainability and capacity, we decided to propose a training of trainers. So the community members or the facilitators of these parent circles will conduct trainings of other parents who have completed the program. This in turn increases trust, empowerment, and longevity. And actually, this is directly impacted by the empowerment model. However, because we do have the open cohort model, not all parents may complete the program, which can hinder this process. For the training plan, we would have all the people who are facilitating or working behind the scenes for this specific project to be trained in app logistics, social inclusivity training for those who are not already familiar with Esperanza's community or the nearby Kensington area, pre-post tests and workshop evaluation training, focus group guidance, and the open door tutorials, like the frameworks that we had provided them would have to go through a training process. In class, we also talked a lot about how dissemination would work and how that would impact the community and ongoing research. So we decided to propose an academic paper for the academic space, policy brief and news interviews more for the general public, and also how things can be done better or maybe even used for other organizations that may be going through this problem. For impact, we would want standardized methods for evaluation where we're understanding weaknesses in the program for future change, and we're building programs, staff, research, and teaching capacity. This is something that we look at for long-term, where we want to create long-term sustainability. So again, directly going at the empowerment model and using the community members as resources. And this is just a timeline from the app creation all the way to dissemination, where we would, for the time span of the project. And for recruitment and training purposes for the parent circle, we want to include all those best practices that I mentioned earlier, as well as the training for pre and post tests, the open door evaluation presentation, administration access and training, and then all the focus group guidance questions. All right, these were all the references that we had used, and thank you so much for listening to our presentation.
Excellent. Thank you so much, Megan and Alexa. We will jump to our last presenter. We have a little less than 20 minutes, so we're kind of right on time. So Dahlia Stott is a third-year PhD candidate in nutrition sciences in the College of Nursing and Health Professions. Within community nutrition, her work focuses on how to promote healthy dietary behaviors among individuals. In addition to working on her dissertation, she also coordinates an R01 longitudinal study in the Drexel University College of Medicine. So I will let Dahlia share her screen and share her presentation with us.
Thank you very much. So my presentation today is a portion of my literature review from my dissertation. And so today I'm just going to be going over the relationships among interactions with nature, mental health, physical health, and health behaviors. In the United States, there are at least 2 national programs that encourage physicians to prescribe nature to their patients to aid in the treatment of diseases such as type 2 diabetes. Similarly, doctors in Canada are making headlines for prescribing time in nature, but also providing their patients with free passes to national parks. These programs are informed by research that suggests that individuals who spend more time in nature have better mental and physical health. Now, there are 3 types of interactions with nature: indirect, incidental, and intentional interactions. Indirect interactions are interactions where you're experiencing nature without being in nature, such as looking at pictures of nature or looking at nature through your window. Incidental interactions with nature are experiencing nature secondary to the main activity being performed, such as taking care of houseplants or walking through a park on your way to work. Intentional interactions with nature are possibly what you first thought about when I introduced this topic, and that's purposeful interaction with nature, such as going to a park, hiking, exercising outdoors, and gardening. And I'm going to discuss how all 3 of these types of interactions with nature, how they're related to mental and physical health status. Now, indirect and incidental interactions with nature have mainly been associated with positive mental health status. Viewing nature through a window, an indirect interaction with nature, has been positively associated with greater capacity at work, well-being, life satisfaction, and happiness. And having houseplants, an incidental interaction with nature, has been associated with reduced depression and anxiety. An example of the positive relationship between intentional interactions with nature and cognitive health comes from several studies published by Berman et al. In these studies, individuals were asked to remember a set of numbers and then walked in a natural or an urban environment. After walking in one of the 2 environments, the participants then repeated the numbers that were presented to them at the beginning before their walk. Individuals who walked in the natural environment were better able to recall and repeat these numbers than individuals who walked in the urban environment. Other studies have interviewed participants after they walked in nature, and these participants indicated that they felt that their stress decreased during the walk. One participant said, "I felt a change in my mindset. I felt my head clear of things I'm stressed about, and I felt lighter." When we're spending time in nature, we are more relaxed, as exhibited by studies that study physiologic exhibitions of stress. And these include, after spending time in nature, a decreased cortisol, decreased blood pressure, decreased heart rate, increased parasympathetic activity, our rest and digest, and decreased amygdala activity, which is generally a part of your brain that activity increases when it is stressed. In addition, individuals report higher quality of life, better perceived health status, and better sleep. And after interacting with nature, individuals have more natural killer cells in their body, thus improving immunity. Greater duration and frequency of intentionally interacting with nature has also been positively associated with the engagement in physical activity. Even the perceived amount of neighborhood greenness is associated with engagement in moderate to vigorous physical activity. Not only does intentionally interacting with nature promote physical activity, but outdoor exercise enhances the benefits of physical activity. When compared to individuals who exercise indoors, those who exercise outdoors report lower levels of somatic anxiety. Gardening is also an intentional form of interacting with nature. And gardening has been consistently associated with greater fruit and vegetable consumption. These benefits extend to the entire household. Individuals with a household member who gardens are 3.5 times more likely to consume fruits and vegetables 5 times per day. Now, there have been multiple gardening interventions that have been successful in increasing fruit and vegetable consumption. When these participants in these studies are interviewed, we learned that they attribute their greater fruit and vegetable consumption to the garden that they grew. One participant says, "I value more the things that I cook and the things that I get from my garden over the things I buy. There's a big difference. So I have a greater desire to eat it. I feel good that I grew it and I'm eating something that I grew. So for me, it's priceless. The fact of cooking something that I grew is something that's important." Despite all of this research about the relationships between interacting with nature and health, limited research has investigated the relationships between interacting with nature and other dietary behaviors. Understanding these relationships is important because consuming a high-quality diet is inversely associated with the development of diabetes, cardiovascular disease, and cancer. In 2016, the average healthy eating index score, a metric of dietary quality, was only 57.7 out of 100, a score that can definitely be improved upon. Similarly, having sustainable eating behaviors, and as I define them in this project, is consuming foods that have less CO2 emissions and are good for human and planetary health. So having sustainable eating behaviors have also been inversely associated with diabetes, cardiovascular disease, and ultimately mortality. Now, diet quality and sustainable eating behaviors emphasize very similar things. They emphasize the consumption of fruits and vegetables, and they encourage the limitation of added sugars and refined grains. Discovering explanatory mechanisms to this potential relationship would be beneficial to inform interventions aimed at improving dietary behaviors. To review, interactions with nature have been positively associated with cognitive, emotional, and physical health status and health behaviors such as physical activity and then fruit and vegetable consumption. But more research studies are needed. If you noticed, I only had one slide about incidental and indirect interactions with nature. These are really important interactions with nature that are less thought about, and we definitely need more research about how what relationships these have with other cognitive, emotional, and physical health status. In addition, as I mentioned, more research studies are needed to learn more about dietary behaviors and how they relate to interacting with nature. Future research should explore the mechanisms by which interactions with nature promote dietary behaviors. And these mechanisms can inform dietary interventions aimed at promoting dietary quality and sustainable eating behaviors, among other dietary behaviors. Thank you very much.
Excellent. Thank you all so much for sharing your work. We have like 9-10 minutes-ish. So if there are any questions, either that you all want to ask each other or any of our participants in the audience, attendees, you're welcome to also either unmute and share a question in the chat or, share out loud. If there are none, I also have something to ask all of you as well. So don't worry, there will be questions. But I want to give you all a chance to maybe engage with each other as well.
Bella, I have a question for you. During your time in Copenhagen, and then reflecting on your time in Copenhagen, what other programs do you think could be implemented here in Philly to support individuals who suffer from addiction, who suffer from this type of drug addiction?
Oh yeah. Oh my gosh, I'm so glad you asked. People have asked me to stop talking about Copenhagen, so thank you. So the first thing that comes to mind is something that we talked a lot about as a group in Copenhagen, how unrealistic it would be to come to fruition now in Philadelphia, but is so, potentially so helpful. And that is something called Valmuen, which is the Danish word for heroin. And it's actually a heroin clinic. So people who use drugs, mainly heroin, who have not had successful outcomes with methadone treatment, go to this clinic where once in the morning, once in the afternoon, they'll take a controlled dose of heroin from the clinic. They have about 15-20 minutes of watch time after taking the dose, and then they are free to go about their days. We actually met with a drug user who started using heroin just like socially, and then developed a dependency on it and is now back on her feet. She got an apartment, great job, great husband, great life, because of the clinic, that she's able to regulate how she uses heroin and where it fits in her life. So we talked a lot about like the social environment of being in the US, especially in Pennsylvania, and like how this could even happen because of the discourse that would inevitably surround it. People would jump to say like, oh, you just want to give people drugs, but these people are able to have a sense of control over their life with their addiction, which is usually the semblance of that being dissipated is usually such a large catalyst for it becoming worse. So I think something like that would be incredible to have in Philadelphia, but a lot of work needs to go into that, as I'm sure we can all imagine. But yeah, they got it figured out over there. If you haven't gone, I recommend everyone go. Yeah, thank you.
Any other questions?
Yeah. Oh, sorry, go ahead.
No, please go ahead.
Yeah, hi. I have a question for Dahlia. So I recently just started, deciding to interact with nature more often. And I like that you talked about the indirect. I think I've been doing a lot of indirect interaction, just looking up places I wish I were, but never really going there. But for someone who lives in a city like Philadelphia, and just thinking about maybe gardening or just kind of having like a little slice of nature, like what are maybe some of the, what's the word I'm looking for, suggestions that you might have, especially for someone who's a student too, right? There isn't enough time, and also I don't know, I just kind of see it as such a difficult thing to live in a big city like this and still be able to make time to interact with nature. But there must be a small way, right, to bring it into our lives, everyday life. So I don't know if you had any like more practical things that people could do.
Yeah, I I love that you asked that question. I feel like even in this space, I don't spend enough time in nature. And so one thing that I've been reading as I've been looking at these national programs is really finding a routine that works for you, whether that's even, if you, let's say that you live right around Drexel's campus. There's like that park right by the Rush building, and it's kind of in the center of campus. Even just spending your lunch there once a week, I think that would be a great way. I think I've recognized more as we've come into spring, just how powerful sounds outside of the urban environment are. Having that visual and that auditorial aspect, I think, is really important. So I would suggest looking for for intentional interactions with nature. Again, that's where most of the research is. Looking for parks that are around you and carving out 15-20 minutes of your day, even just once or twice a week, to go and interact with that nature, whether that's just sitting and reading a book or just watching the birds, whatever you want to do in nature and whatever gets you excited to go outside. That's what's really important.
Thank you. Yeah, no, that definitely sounds practical. Yeah, I think that's a good way to kind of incorporate it in a busy schedule, like living in such a huge city. So thanks.
I think, Alexa, do you have a question as well? Maybe it'll be our last question for the afternoon.
Yeah, sure. My question was for Hebah. I was just curious how the education was working with, I already forgot the name of the island, but the folks on the island and kind of the malaria education. What did that look like for them? And how were you involved in that if there were?
Yeah, so the education, there's community workers that go out, and also those who are spraying the homes, sprayers, they try to educate the community, but it's also challenging because there's a lack of trust and there's hesitancy, and especially with the insecticide, homes with young children, all that stuff. And it's also an inconvenience because when I got to accompany them on their spray routes, and what little the homeowner has to be covered, and we try to move food outside the home, and after they spray, they can't go in the home for 2 hours. So it's just an inconvenience. And then it's also the understanding of what the insecticide does. People, I guess, just think that they're not going to get malaria, or it's going to keep mosquitoes away from their home. But that's not how it works. So I just think there's a lack of really explaining to them what it's actually doing. And also there is a lot of corruption in Equatorial Guinea. So, what I presented today was just a small portion of the entire project, but they have a high GDP, similar to Italy and Saudi Arabia, which is so large, and but there's still a lot of poverty there, and there's a lot of money that leaves the country and is in offshore bank accounts, and there's not enough money being invested in the health structures of the country. And because the people know that there is money from oil, but they don't see it, they're still living in poverty. So I do think that there's still a lack of trust. And, some of the things that I saw there, people are more open to talking with you and sharing things with you. But if it comes down to you testing them or asking for a blood sample, they become more hesitant, which is understandable. And, it's the same, we kind of experienced the same thing here during COVID, where, there was the whole thing of, I got the vaccine, I still got COVID. So it's the similar thing, even though it's, halfway across the world, it's, you know, same thing over there. But as far as like how I was involved, so this was a study abroad opportunity that was with my old university that I went to. One of the professors reached out to me and told me about it. And so I got to accompany him and some of his students on this trip.
Oh, thank you for sharing.
Yeah.
Excellent. Well, I think we are exactly at 3 p.m. So I want to thank each of you for sharing your work and getting a chance to kind of talk through your projects and your ideas and engage with each other. And I think that will end our panel for this afternoon.